Hello and welcome to Place Hospital's podcast. Today we are diving into one of the most popular cosmetic procedures known for enhancing confidence, that is rhinoplasty, which is widely known as the nose job. Whether you are considering rhinoplasty for aesthetic reasons to correct a breathing issue, or you are simply curious about how this surgery works and what it can do, this episode is just for you. Joining us today, Dr. Kantamneni Lakshmi, Senior Consultant, Plastic, Cosmetic and Reconstructive Surgeon, having wide expertise in treating and managing rhinoplasty. In this episode, we will break down the purpose, the procedure, what to expect during recovery, and the real benefits and the risks you should be aware of before taking the next step toward a refined and balanced facial profile. Dr. Lakshmi, thank you for joining us at Pace Hospital's High-Tech City. Let's understand exactly what is rhinoplasty or nose job.
It is also called as nose job or nasal reshaping procedure. In this procedure, the deformities of the nose can be corrected and also the functional issues of breathing are corrected.
Dr. Lakshmi, what is the procedure of rhinoplasty?
Before proceeding for the surgery, any patient who comes to me, I will ask them medical history regarding any intake of drugs, any medicines which can cause bleeding, or if they have any bleeding disorders, or if there are any long-term medication which they are using for other illnesses which are related to the procedure, and also any history of surgeries for the nose or any difficulty in breathing or any issues related to the breathing, I will confirm before going ahead with the procedure. And after the medical history, I will examine the patient, the face in total, and the nasal proportions in the face, the symmetry, the size of the nose in relation to the overall face, in relation to the chin, and any structural abnormalities externally and internally also will be assessed in physical examination. After the physical examination, a set of photographs of the nose are taken in different directions, in different angles, so that it can be explained through the photographs to the patient in a better way, so that they can understand what to expect from rhinoplasty surgery and what are the main concerns in this surgery and why they are going for this procedure will be discussed in detail. And then we can go ahead with the surgery, which is done under general anesthesia. The procedure usually takes around 3 to 4 hours. Patient can go back to home on the same day, or if it is a simple procedure. Otherwise, if there is any nasal packing, we'll keep him a day or two to remove the nasal pack and then send him after 1 or 2 days. And there will be a splint placed immediately after the surgery on the operation theatre table itself, so that the swelling and the contour of the nape which is corrected can be retained.
So, doctor, what are the benefits of rhinoplasty?
The main benefit of the rhinoplasty procedure is that one can choose how much of alteration of the size shape of the nose can be done, and also in relation to the face, the symmetry of the nose can be achieved. If the tip is bulbous and if it is upturned or droopy, the tip can be corrected. If there is any problem with the nostril shape and size, the asymmetries can be corrected. The profile of the nose, if there are any humps or any depressions, can be corrected. The broad nose, either the bony part or at the lower third where the nostril opening is present, that also can be corrected. Apart from this, the functional or breathing issues of the nose can also be corrected.
Dr. Lakshmi, who needs rhinoplasty?
Patient who has a congenital abnormality like cleft lip nasal deformity may require rhinoplasty procedure at various stages of their life. It can be either primary or before attaining adult period or after 18 years of age. Second reason is that if they want to improve the nasal symmetry, size and shape. The third one is that the nose in relation to the face and its symmetry can also be corrected. The fourth one is that if there is any trauma to the nose which can cause fractures of the nasal bones can also be corrected with rhinoplasty. Any other conditions like infections or saddle nose deformity secondary to procedures and any breathing issues also can be corrected with rhinoplasty procedure.
Could you explain how long does it take to recover from rhinoplasty?
It will take around a day or two for a patient to get back to their daily activities. Since there will be a nasal splint for at least a week or so, return to work will be difficult. So at least a week or so will be required to get back to their work. And one can expect swelling at least few months after the surgery because the swelling will take a little longer over the nose to go away. And apart from this swelling, the nasal pack which is kept will be removed within first 24 to 48 hours and a splint only can be kept. Apart from this, we will advise the patient not to put any pressure on the nose and avoid sneezing or coughing. In case if they have to cough, they have to cough with mouth open and avoid spectacles at least for few weeks after the surgery and avoid any pressure on the nose. And for the swelling around the nose, around the eyes, they can use some hot pads or cold compress with ice to decrease that swelling around the eye area. And we also advise the patient to avoid any intense workouts which will cause sweating and which will increase the effort of the body. And also we will advise the patient to not to take hot showers because that can also cause some irritation in that area, and also there can be a risk of bleeding after the surgery with all these activities.
Is rhinoplasty procedure painful?
I would rather say it is more of a discomfort rather than pain. Pain is usually mild to moderate. On a scale of 1 to 10, it will be around 4 or 5. The discomfort is mainly due to the splint placed and also the nasal pack placed initially in the first 24 to 48 hours. The swelling usually will go down in a week or so that won't be much of a concern.
So doctor, let's talk safety. Just how safe is rhinoplasty as a surgical procedure?
Yes, of course, it's a safe procedure. There are very minor risks or complications associated with it. And this procedure has to be done in an accredited facility where all the available instrumentation should be there and necessary backup is there. So I would always advise a patient to get it done in a proper accredited hospital with ICU facility.
Dr. Lakshmi, one common concern we often hear is, does the rhinoplasty procedure leave any visible scars?
Usually, there are two types of rhinoplasty surgeries. One is a closed one, another one is a open one. In closed one, all the scars will be placed inside the nostril areas which are not seen. In open rhinoplasty, there will be a scar between the nostrils at the base of your nose. That is a very small scar which won't be seen usually in a normal view. Only when a person lifts their head, that can be seen. That also it will be very faint and the scar will go away with time, or it will be minimal with time. So you don't need to worry much about the scars as it won't be seen that much.
So doctor, what are some potential complications patients should be aware of before undergoing a rhinoplasty procedure?
With any surgery, there will be a complication like bleeding, infection, and swelling. These are also common with rhinoplasty procedure, which will be taken care of, and the complications are not so common these days because we take all necessary precautions to avoid these complications. Apart from this minor complications, one can expect a swelling for long duration after the surgery, and there can be altered sense of smell, and there can be some scarring or hyperpigmentation over the nasal area. These are the rare complications after rhinoplasty procedure.
Dr. Lakshmi, one final question. Can rhinoplasty be performed on patients who suffer from sinus problems?
I would say no, because any inflammatory or infective condition, we try to avoid a clean surgery or any surgery, because the infection and inflammation will cause more of complications for the surgery and post surgery. So I would advise not to go, and rather treat the sinusitis part and then come back for rhinoplasty procedure.
Thank you, Dr. Lakshmi, for sharing crucial information regarding rhinoplasty procedure with our listeners. I hope this information empowers our listeners by highlighting how understanding the benefits and risks of rhinoplasty can make a significant difference in the decisions people make about this procedure. Hello, listeners. If you have any further questions regarding rhinoplasty, please don't hesitate to consult an experienced facial plastic surgeon. Remember, early consultation is key. Understanding the procedure and addressing concerns upfront can pave the way for the best results and a smooth recovery. We will see you soon on the Pace Hospital podcast with another episode. Until next time, take care and stay healthy. Thank you.